All right, everyone, spring is here in Minnesota and
Spring has sprung.
Wisconsin, and people are getting out unbelievably. You can see them on the sidewalks all over the place, running, hiking, and along with that, muscles that are moving them are getting pulled, strained, injured. We're talking about the hip muscle, hamstring, and
Calf.
that calf muscle. If you have any of those problems, stick around. We're going to show you a number of just different ways to make those feel better, get you back out on the trails, back into your activity. I better quit babbling.
Don't miss it.
Bob and Brad, the two most famous physical therapists on the internet.
Bob, and I think you're going to agree with this. A lot of people, including myself years ago, when you pull a muscle, you strain a muscle, the knee-jerk reaction, no pun intended, is to stretch the
Stretch it
muscle.
right away.
And that is not the thing to
Right.
do. You've already strained a muscle. You've got some micro tears in the muscle tissues. If you stretch it,
You'll make it worse.
there you go. So we're going to show you what to do initially. We will get to stretching it, but first of all, what are we going to do?
We're going to rest it, and we're going to use the cold pack.
That's right. Give it a
How
break.
come yours is bigger?
Well, because
There we go.
if you got it on your thigh, you'll use it here,
My
small one
calf.
for the calf. Again, cold packs are nice. Get the ones that are gel filled or a homemade one, which we do have a video on how to make a homemade cold pack. All you need is water, some rubbing alcohol, and they work very well,
You might
actually.
also try some NSAIDs, non-steroidal anti-inflammatory drugs.
Right. So ibuprofen is, the go-to with that, or some whatever else you like or your doctor instructs you to use. Once you get it to settle down a little bit, within a day or
Right.
two,
Couple days.
then we're going to do some soft tissue work. We've got a plethora of ways of doing it. You don't have to buy anything, but we'll show you some things that you want to buy or you maybe already have at your grasp. All right, now most people have either a tennis ball, a softball. If you don't have one, go to the neighborhood park, search around, you'll find one. You don't have to spend any money that way. One thing we want to do, if you got a pulled calf muscle, you can just put a tennis ball, works well, under like that, and you can just start to roll it
You
like
find
this.
a tender spot, and you work on that
Yeah.
spot.
Look at these socks, by the way. Pretty cool, huh?
Yeah,
You
right.
don't have to have those kind of socks to get these results.
Yeah.
You can go to the calf.
No kidding.
And you can go up into the hamstring. Now, the hamstring, for a lot of people, you find this is too small.
And that's why a softball comes in. And actually, if you're on a high surface like this, a table, you can actually put the ball under the hamstring,
Yep.
and it can actually floss while you're working on the hamstring.
So flossing, he means what he's doing with his leg.
It's moving up and down, working the hamstring while I'm flossing it or massaging it.
Right. It's a really simple, effective way to do it. And it's like I said, the price is great and it works good. You have to kind of work with that. You'll find the knot, the sore
Right.
spot. And when you get on it, work with it.
You're working it.
Don't get too aggressive right away. The next thing I want to talk about, now, this does work on the hip. If you're on a hip, the tennis ball, but you're going to adjust the weight.
Stay off the bony part of the hip.
Yep. And you'll spend a couple minutes on here. And again, you'll find where the injury is. You want to work on that if it's not too painful. If it's too painful, work around it and the muscle tissue surrounding the injured area.
A foam roller works well.
Yep. These are wonderful things. Some people already have them. Again, if I'm doing the calf muscle, you can do both at once. If you want to get more aggressive, if this is my injured calf, you can go over the top, and that changes the aggressiveness
Right.
a lot. And then roll to the side in case the injury is lateral,
Right.
inside, go right up to the hamstring in the same situation. Both hammies cross to get on one, roll on the side, wherever the injury may be. I really like this for the hip.
Yeah.
Yeah, because you can get
You
in.
find the spot.
Yeah. And this is a medium density. It's not really hard. The black ones are more dense and hard. But when you get on the hip, I like the softer one if you do want to get one of these. And they tell you when you're buying one what density they are. Oh, boy, that was good. I'm feeling better already, and I wasn't
All
even
right,
injured.
Let's move on, Brad. All right. A little more expensive option is to actually use a massage gun, and we actually are releasing a Bob and Brad massage gun into the Walmart stores. So this is the EM19, very nice unit. It's actually got 20 speeds.
Right.
Have you ever heard of a gun having 20 speeds, Brad?
Well, I have now.
But it works really well. I use it on my calves every day.
Yeah.
I did it this morning, Brad.
Yep.
So there's not a day that goes by. It feels really good. This one has a lot of amplitude, which means it goes very deep.
Yep.
And the other thing, stall force is nice. I mean, I can't make it stall.
Right. You push. Yeah.
How hard I push.
Right. Yeah. We have tested this gun extensively, and it is a quality gun at a great price. So you don't have to worry about that. Bob, you want to talk
Yeah, I'll
about?
talk about this if you want to hold on to it. It actually has 6 different heads. I like this head. It's the bullet head, very aggressive. Probably
And you use that on your calf.
right.
I,
Most-
I can. I'm too
Right.
I'm too wimpy, but I don't. My calf is not that tender, or doesn't need it. But
It's got a flat head. It's got like a field goal. It's
We-
got 2 balls.
So actually, what I'm going to do, Bob, is whoa, turn it off. I'm going to use on my hamstring. I'm going to change to the larger.
By the way, while you're doing that, Brad, I'm going to mention that the gun is only available in 500 Walmarts so far. So we'll have a list of which stores it is available at in the link below. So check out and see if your hometown has one of the fortunate massage guns.
That's right. Now, for the hamstring, I like to use this larger head, and I can get in there real deep. And again, we talked about the flossing. If you have a roller, you can just use that for flossing and roll back and forth while you're doing that. You can.
I was going to say, yeah, you can slide it on a garbage.
Well, yeah, you can
cover.
use any sheet of plastic. I happen
Right.
to be using a clipboard. It works really well. You know, on carpet, it's an issue trying to go like it doesn't work at
Right.
all. We do have
The knee glide.
the knee glide. If you happen to have one, you can use one of those. I wouldn't buy a knee glide just for flossing
Right.
this, but they do work well for other things as well. If you have arthritis. Now, if you're using this on the hip, I'm not going to pull my pant leg all the way up here.
Thank God.
And you can do this seated position.
Hip or buttock.
Oh, yeah. I like to get right around my SI joint, which is closer to the sacrum.
Sacrum.
Yep, and that piriformis muscle. I had a gentleman, he had a hip replacement, and he used a gun almost similar to this, our other C2.
Sure.
And he used this extensively before surgery for about 2 months. It helped keep the muscles loose, and it made surgery go better.
I'm going to warn you, though, if you are elderly, I would not recommend this gun. I mean, this is a big, powerful gun
Yeah.
for big muscles, and it's not for somebody who's slight of build and maybe, osteoporotic.
Right. Yeah. It's for the more active,
Athlete.
more muscular
Right.
person. We're going to get into stretching because after you massage for a few days, you may be ready for some gentle stretching to get that muscle back into gear.
All right, I'm going to show you some stretches you could do here. First, we're going to start with the hip itself. You can actually just pull the hip towards you, and you're actually going to keep this one straight while you do it. And you can do either side, of course.
I would stretch even the non-injured side just
Right.
so that you maintain the healthy
Right.
one.
Then we're going to go into a hamstring stretch. And I like the 90-90 position. So the hip is 90 degrees, and you start 90 here on the knee, but you actually work on trying to straighten it.
Yeah. Here, you want to try this, Bob? If you want to.
Sure.
You can use a belt at home. You don't have to have a stretch strap. These work well because you don't have to grab. But this makes it easier. And if, like Bob's getting his knee almost straight, when you do that, you're pretty darn flexible.
Right. Now we'll go into a hip stretch here,
Yep,
Brad. Figure
good.
4. You can actually just start with the legs flat, and you cross the ankle over the knee, and you actually push the knee down towards the bed. You can use your hand. You can use your active muscles to
Can you
do
get the
so.
other angle?
But this works really well. And of course, you could do the other side.
Yeah.
And then you could do it also in a figure 4 with the leg raised.
And then actually, that where you pull it up and do the
Like this.
no with the other leg.
Oh, this, yes.
That's pretty aggressive.
This really gets her going.
Now you got flexible hips. Bob.
Yeah, I work on my hips a lot.
6.5 foot.
Yeah,
Just
that's
stretching
right.
right out there.
That's right. I'm a Gumby and a Pokey. All right. What else, Brad?
Oh, you can do the hip extension off the bed.
All right.
This is not
Stretch
for
the hip
everyone.
extensions. You go to the edge of the bed. Keep the shoulders well on the bed. And as you get the leg over the bed, I'm stretching this hip flexor, and I'm going to bring this leg up.
Yep.
You can see how it actually is stretching that hip, pulling up.
All right, we still got the calf to address.
All right, Brad, you want to try the calf?
Yeah, so the calf muscle, I'm going to show you the basic one, doing it standing. You can go up to a cupboard or anything like that and stretch. Let me get this chair out of the way. Keep the toes straight towards the front, not out to the side.
Right.
Stretch, keep the knees straight, lean into it, try and keep the heel on the floor. You can bend the knee and stretch so you get the deeper soleus muscle. I usually do this one on the wall like this. So this one is getting stretched. Hold these 15 to 30 seconds or pressure on, pressure off, just like that. Cadence for 10 repetitions. My favorite, or one of my favorites, is going to an incline board.
Right, what you created yourself.
Yeah, I made
built
this
it.
one. Anybody can make one. We have a video on how to make one of these. You know, if you're handy and you got some spare wood laying
Right.
around. Whoops. But this,
That would not be me.
yeah, it's not for everyone. It's one of those deals. They're not very expensive either. But this, I feel, is superior versus
Right.
the wall stretch, but not necessary. But you know, anybody who walks a lot or runs, I think really should, if they invest in one of
Well,
these.
I think everybody should stretch the calf muscle, Brad.
Yeah, you're absolutely right. I didn't want to sound
It's
too
a
forward.
muscle.
Yeah, so if you're anybody, get a calf stretcher. You don't have to do this, but stretch them on the wall. Do what you need to do because those muscles are working a lot.
All right, have we done everything, Brad?
I think we did, Bob. We covered that. That was a lot more than I
Remember,
anticipated.
Brad and I can fix just about anything.
I forgot about this, except for
A broken heart.
that's right, and none of these stretches are going to help anything to do with the broken heart.
Nothing has helped.
Not
so
even the
far.
massage gun is going to help. I don't
That's
think.
right.
Maybe we can work something in there.
Right.
Be careful.